Welcome. We are beginning a new module this week, Module 3. Before I get into that, I just wanted to let you know I'm continuing to grade everything that you've been turning in for modules 1 and 2. I won't start. I know some of you have worked ahead and have submitted some module 3 stuff. I haven't started grading that yet. I hope to actually probably next week, maybe even this weekend sometime. But I am finishing up some module 1, which very little of that remains, which is good. In module 2, there's still a few items coming in and some items I still need to grade in there. So anyway, that's kind of the update from the past. Now, presently, or in the present, we're going to begin module 3 this week, cardiovascular system, which is actually going to go 2 weeks. Is going to be a couple of weeks. So next week will kind of be a catch-up week. I'll still do a video. I may jump into renal next week and then respiratory the week after that. But again, if we look at the calendar, come over here. Okay. If we look at the calendar, again, I have, oh, wait, that's the 8th week. Anyway, here it is. All right, so cardiovascular again, I have going in this week and next week. So anyway, this will be a 4-week module. So, but again, I'll still be putting a video up next week. So anyway, gives you a chance to work ahead, get caught up, or stay right where you are. Anyway, so if we click that, open that. Module 3, again, it's going to have competency 7, which is cardiovascular. That's what we're doing this week. And as with the previous modules, we see the engage, comprehend, practice, and apply folders. And again, in the engage folder, you're going to find the Padlet for this week, which is right over here. And again, I recommend watching all of the videos. You're only required to comment under any one of the videos. You can watch them all and only comment on one. I mean, that's fine too. I don't expect you to feel obligated to comment on more than one, even if you've watched more than one. Some of them are short, a couple of minute videos, but again, they're all very helpful. Now, EKG is part of this particular competency. So there are a couple of items there that you're going to want to watch. Now, when it comes to the clinical setting, you will be, I don't, if you're going to be like a tech, you're going to have to go through specialized EKG courses. So if you're not going to specialize in cardiovascular, or if you're going to specialize in cardiovascular nursing or cardiovascular medicine, you definitely would get a more kind of a beefy introduction and a little deeper into EKGs. So, but anyway, I just give you the surface stuff here. That's all you really need to be aware of at this point. So anyway, that's a couple of nice little videos in there. I believe the NCLEX does ask a few questions on EKG, or there's a potential that you would see a question or two on those. So anyway, there you have that. Let's see. And again, the Padlet questionnaire, you want to make sure you fill that out as well. And let's see, case study 7. We're going to go through that here in a couple of minutes. It's on cerebrovascular accident or a stroke. So we'll take a peek at that. And then you're not going to have, kind of looking ahead real quick, competency 12, the very last week of the semester, you're not going to have a PhysioX for that competency. However, you still have 12 PhysioX assignments to do. So in this competency, again, it's a 2-week competency. You will have 2 PhysioX, actually, you're going to have 4 activities. You're going to do 2, they're very short. And I have the videos in our YouTube course playlist, so I'll show you those as well. they're very short. So you're going to do activity 1 and activity 2 under PhysioX exercise 5. So we'll take a peek at that, and I'll give more clarity here in just a minute. And then for the second PhysioX Dropbox assignment, you're going to do activities 3 and 4. So anyway, ultimately you're going to be doing the first 4 activities in that PhysioX lab exercise 5. Uh, so anyway, but you don't have to do one for competency 12. So, and again, you can do the extra credit. There are 7 activities in that particular PhysioX. You can do numbers 5 through 7 for, again, maximally 10 extra credit points. So, and of course, the review questions are in there as well. The test bank pool, again, those review questions are from the pool. And then there's your exam 7, which, as you all know by now, unlimited attempts. They are timed up to 120 minutes. I don't think very few of you go over that, and it's fine if you do. You can take, there's no penalty. Unlimited attempts, they're open till the end of the semester, which is April 26th. And it keeps the highest score. So anyway, we're going to hone in on cardiovascular for the next couple of weeks. Now, let's see. I wanted to again remind you that you do have your quick links or your hyperlinks down here. Again, those exam review questions are going to be from the pool. And then we now move into module 3. So you're going to be in a different area for video lectures and PowerPoints. And of course, these are also, the videos are going to be found in our YouTube course channel. And there's a hyperlink. That's to just the general module 3 playlist. But I believe, brother, I thought I had, anyway, I'll put the link to our YouTube course channel. I thought it was in here. So anyway, I would think by now you've located it. But anyway, if not, I will put it, I'll make sure to put it in the link below this video at the very least. And then I'll put it in Blackboard as well. The Wednesday Zoom sessions. If you go into there, that's where you're going to find the video for each week. And those are also in the playlist. So you can locate the playlist in YouTube. But I'll just put the playlist up at the top. So there'll be a hyperlink under Wednesday Zoom sessions. Or maybe I'll just put it out here. I'll put it out on the side, a YouTube, our course playlist. Okay, because that's extremely helpful if you haven't seen that or found that yet. All right, so anyway, module 3, video lectures and PowerPoints. This is a hyperlink here that'll take you to the 3 main video lectures on the content. Now, which those are also going to be located in our core. I created a course playlist for spring 2021 advanced A&P. So that's going to have some PhysioX videos. That's going to have all of our weekly Zoom sessions in there as well. All right. So anyway, competency 7. There's the video that'll take the link that'll take you to that video. This is more what I wanted to show you again. If you click competency 7 slides, it's going to open these. I just want to do a quick review of some of my links to the Google Slides are going to take you right to Google Docs or Google Slides. Others are going to open up the actual Google Doc or or not the Google Doc, the Microsoft Word doc or the PowerPoint. So that's what we see here. So what you're going to want to do when it opens like this, I mean, you can download it. You go over here, you can download this slide presentation into your PowerPoint if you have. I'm assuming you have PowerPoint. If you don't, the college does have a free Office 365. That's at the top of the Blackboard, your Blackboard homepage under student services. So anyway, if you have questions about Office 365 and you need free access, just shoot me an email and I'll tell you what to do to get that. But anyway, so competency 7, PowerPoint. So this, you can download this as the PowerPoint. You can also open it as Google Slides. So hit open with Google Slides. And then from here, it's still going to be in PowerPoint format, which may be fine with you. I mean, um, you know, there's not much difference. There's some translation issues sometimes with pictures or photos or images. But from here, and this holds true, like if this said doc, that would tell you that this is a Word document or a PowerPoint. Two things, the documents and PowerPoints, anything I provide you with is going to be it's uneditable on your end. Now, if we go back to here and you download it from here, you would be able, or if it's a Word doc, you would be able to download to your computer. At that point, you could edit it. But if it's in Google Docs or Google Slides, which is what this is in, all of the stuff you would get from me is read only. So how do you get your own version of it? Two different ways. First of all, you can click save as Google Slides. That'll push this over to Google Slides, and it's the same file, so it's still going to be read only. Okay, so it's basically the same thing that we see over here. But some of you may be viewing these on your tablet, on an Apple, on or Mac product, maybe on your cell phone. So it's easier to sometimes to view items when they're in Google Docs, or in this case, Google Sheets. Okay. So anyway, that's how you can do that on your own, and you're not stuck with just the PowerPoint. And then again, if you from here or from here, you can also save your own to edit it. And this again holds true for a Google document. So like the case studies, or some of the PhysioX, all the PhysioXs have the Word doc version. You could you just download your own. So go to download, and then Microsoft PowerPoint, you just download it to your computer. It'd be your copy. You could edit it all you want. So again, same holds true with a Word document, like with the case study. If we go over to the case study questions, this is read only. So you can click File, Download, Word doc, and then type right into it. You can also click Make a Copy, and that copy becomes yours that you can type in. It's going to be a Google Doc that you can type right into. Some of this all of you already know, or some of this, all of this, some of you already know, some of it, some of you know, and some of it, none of you know. So anyway, hopefully some of you got something out of that, or at least a refresher. So anyway, let's go back to where we were. All right, so we're in the slides. You know where to find them. And then the videos, the lecture that goes with these slides is right here. And again, I wanted to reiterate or remind you that at the bottom, I do have notes that go with each slide. So make sure that you look at those as well. Those are helpful for exam preparation. Okay, so Padlet we did, case study. So let's move on. All I really want to talk about today is the case study, because so I guess it's a good time to go to our course channel, our playlist. So again, we have a spring 2021 advanced A&P playlist. I think most, if not all of you, are aware of it. I'll put the link below in this video, and then I'll put it in your Blackboard shells as well. But this has everything that we do in chronological order. So competency 1, 2, and 3 are all there. Now competency 1 video and 2 video, that has some of the lecture, that has case studies and the PhysioX within those. So if you haven't done those yet, you make sure you watch those videos. And then separately, I've got for competency 3, cellular metabolism lecture, along with uh, some lecture up here as well. So there's quite a bit on cell metabolism there. And then the case study for 3, and then the PhysioX for competency 3 as well. Those are all separated out. Then we do last module, competency 4. Again, we have a couple little lecture videos for competency 4, and then the case study in PhysioX as well. And then 5, the case study and PhysioX are in this nice, tidy little 13-minute video. And then the lecture material is going to be here. And then lastly, for module 2, you're going to find case study 6 and PhysioX 12, activity 3 located there, and then both lecture videos. Now, this is what's coming up now. What you're going to, after this video we're recording at the moment, is going to go right here in this slot, and that's going to be that's going to say advanced anatomy and physiology, cardiovascular, competency 7, case study 7. That's all that's going to say. And then you have the 4 PhysioXs. 1 and 2 is one Dropbox assignment. 3 and 4 is the other. So let's go back real quick to our modules and units and click on module 3. All right. All right, and then we go to the PhysioX. It says practice. There are going to be 2 drop boxes in there. And again, the first drop box is really for this week, and the second one would be ideally for next week. So, oops. So anyway, this is the first one, PhysioX activities 1 and 2. And again, they're very short. So we go back to our channel, you can see activity 1, 10 minutes, activity 2, 6 minutes. So again, very straightforward. We go into 5, part 2. So that's part 1. Part 2 is activities 3 and 4. You're going to look at length and blood pressure and how they relate to flow rate. Okay, so you can see those are only about 6 minutes each as well. So, and then the lecture material, cardiovascular physiology, that goes with these slides, boom, is also included in our playlist. So anyway, video we're doing now that's going to talk about the case study is going to be right here, and then that's really all this video will have. Now next week, I'm probably going to jump right into competency 8 and just keep on going. So, and again, if you have questions, please always email me. And if you need to Zoom live for office hours, please let me know. We can arrange something as well. So anyway, let's take a peek at the case study. Some of you have already started on it. Some of you have already submitted it. And again, there are unlimited submissions for all items. So if you're doing any extra credit PhysioX labs, just put them in the Dropbox of the PhysioX regular credit labs that you did for that particular unit. If you do a case study and then we go through some stuff in these videos and you decide that you want to change some things around, you can submit unlimited submissions in for all Dropbox. So anyway, we've got a tradesman's journey back from a cerebral incident. So again, you can certainly, this is in 3 parts. So part 1 kind of lays out the background of what's going on in our case study. So you can read through that. We have a gentleman who has some family history of heart disease. He himself has a history and a current need for cardiovascular meds. He's Lipitor, a statin drug that goes after a specific cholesterol enzyme in the liver. So anyway, there's some background there. I don't want to spoil too much of the fun for you, but I do want to introduce you. And again, if you have questions or need clarity on some of these, just email me and I'll let you know. But this one's pretty straightforward. I wanted to tell you too, or let you know that again. Let me go back to the case study here in your Blackboard. And again, you can get to these through your hyperlinks off to the side, but you have the case study question. So I'm going to open that one up. I added some references. If you've done this already, if you've started working on it, um, I added some links to the bottom here this afternoon. So part one, there are a couple of links there that'll help you out, and then part two talks about the Circle of Willis. This case study is kind of cool. It gives you a little bit of neurological stuff in it. You'll find. It gives you some cardiovascular basics of the A&P or the anatomy, the structural. We'll give you some structural vasculature going really from the heart up to the brain. So anyway, if you didn't do much with Circle of Willis or some of the specifics regarding vascularization to the brain, then this is certainly a good case study for that. And here are some links there. A couple of these are books, so I just put the Amazon links. But these article links, these are free articles that should open you or should take you right to those links if you need that type of help. And then here's some alien hand syndrome links as well. So anyhow, I did add those in. So if you've already done it or are working on it, you want to go back maybe and check those out. Let's see. So anyway, we've got a patient, Paul, who has some issues going on here. Just asks about. So we're relying on his wife, Teresa, to tell us a little bit about what's going on with his history. We want to know and these can be short answer. They can be bullet points. They don't have to be complete sentences every time. So what's the mechanism of statin drugs? I kind of mentioned that a few minutes ago. So a quick Google. Some of you may already know these are one of the most prescribed medications, in the United States. So hypertension drugs and statin drugs, you know, they didn't get much more prescribed than those. So anyway, then some vitals that talks about blood pressure. Some of you do blood pressure in your day-to-day lives. Some of you have done it in the past. Some of you maybe have never done it before. So either way, just go through again, kind of a step-by-step bullet of how blood pressure is taken, what normal blood pressure is, kind of just says, how do you correlate Paul's with his symptoms? So what's Paul's blood pressure? Is it in the low range, high range, ultra high range? There are different levels of blood pressure, hypertension and hypotension levels. So anyway, to speak on that a little bit. And then what part of the brain controls muscle? So you want to talk about the upper motor neurons and kind of where those are located, and what region of the brain and controls that, and opposite sides to right side controlling left side. It goes into more brain stuff, so you can go into as much detail as you like. There's further down, there are more brain questions and kind of what the nervous system is doing for Paul regarding other senses than just movement. All right, so high blood. So would you correlate what's going? And again, this is just step one. So some of this may be more subjective. So um, what do you think's going on there? And then we get some CT scans. We've got an EEG. So it asks why a CT scan, an EEG, and an echocardiogram. So just what are each of those diagnostic tests, and why are we doing them in this situation? Okay. Um, Difference between embolism and a and a thrombotic stroke. Okay. So again, yeah, I don't want to give too much away, but if you have trouble uncovering what embolic stroke is versus thrombotic stroke, and then seeing what the difference is, again, a YouTube video search. I recommend to some students not don't just go into Google to search for something like this. You could go into YouTube and type embolic versus thrombotic. It would just autofill. So at that point, if you type in embolic stroke versus, it'll just pull up thrombotic stroke. There'll be a video or 10 that discuss those things. So don't just rely exclusively on Google. And if you're more of an audio visual learner, man, just go right to YouTube and use that as your search engine for trying to understand some of this stuff. Same with this next one. Where does the ACA originate? And again, these next couple of questions get into the circle of Willis. So the blood supply from the internal carotid arteries going up to the brain. So again, you can do a quick Google search on that or a quick YouTube search, and you can get some good information on the blood supply heading up to the brain. So what we have is this circle of Willis located at the base of the brain, and we have what's called the basilar artery here, and then we've got the internal carotid artery here. And again, these are in um, flat two dimensions, so it's hard to visualize. I think all of or most of you have visible body access, so that's the beauty of visible body is you can turn things around in multiple different directions. You could probably even go into YouTube, type in visible body circle of Willis, and you're going to get them doing a video so you can see kind of how the circle of Willis appears in more of a multi-dimensional fashion. So anyhow, this helps for the moment, but it's asking about this anterior cerebral artery versus this middle cerebral artery. And you can see just by looking at this diagram that we have a larger diameter for the middle cerebral artery than we do for the ACA. So one of the questions discusses how common one is over the other. The MCA stroke is more common, uh, primarily because of, again, that internal carotid area coming up from the carotid arteries and branching off. We're going to see then that internal carotid kind of branching a little bit into that middle cerebral artery, and the diameter doesn't really change a heck of a lot. So the idea is if we do have some sort of a traveling clot, like what we call an embolism, that's then that could possibly land in this spot more than likely. So if we get some plaque buildup that somehow gets dislodged, the likelihood is that it's going to go into this area. We could end up in the basilar region as well, but this seems to be, because again, you can see the diameter of this. Now, so the odds of something traveling and being able to turn the corner and come up here, it can happen. It does. It's happening here in Paul's case. Oh man, I probably already said too much, but anyway, you can continue to. So anyway, Circle of Willis. There are videos, there are all kinds of good stuff, but it'll give you a nice kind of vantage point of what's going on when someone has a CVA, not just Paul's kind of unique situation. And that's not that unique, but it's unique enough relative to seeing an MCA being affected, the middle cerebral artery stroke. Yeah. So more brain stuff. So the next one talking about the location of verbal recognition, verbal, the verbal portions of the brain, communication areas being affected. What do you think the medical student will report back to Dr. Vasquez? So again, you can think about kind of what, just putting as many puzzle pieces as you can. You are kind of the medical student there. Okay. All right. So anyway, journey to recovery talks a little bit of kind of this. Again, it's kind of like before, middle, end, past, present, future. So there are the future outlook questions as well. So alien hand syndrome. Again, you can Google it or YouTube search it. I did put some hyperlinks down at the bottom that discuss alien hand syndrome a little bit. So anyway, that's it for let's see, what's the quadricep reflex. That'll have to do maybe with some there. This one's a tough one to get an exact answer on. I think I kind of want you guys to just go for it with what you think for number two, part three, number two. What is the reason behind the change in Paul's quadriceps reflex during the first couple of weeks after his stroke? So I don't want to give too much away, but it kind of goes back to the upper motor neurons, lower motor neurons potentially being affected. So kind of work backwards from this one. Think about the quadriceps, what nerves supply them, where are they coming from, the motor area is going to be the lower, the lumbo sacral plexus region. So anyway, lower motor neurons controlling quadriceps movement. We got some changes. How does that relate to a CVA? Again, go for it. You'll find some info, or you can just use your own, you know, critical thinking to come up with something. Hey, so anyway, that's pretty much it. And then, kind of what's the outlook and recovery, right? It's going to be a slow process. I think we can all agree on that. Um, all right. So PhysioX again. So that's your case study, PhysioX. And by the way, all of this is due April 4th, but again, you have until the 26th to get everything in. So when we go into PhysioX 1 through 4, you're going to do 1 and 2 is going to be in one drop box, and then 3 and 4 are going to be in the second drop box. And then you can do any of these other three for extra credit. Okay. Let's see. Other than that, again, here's our playlist. I'll be adding this video I'm doing right now into that playlist, and that'll give you the opportunity to just link right to it. So um, that's it. Talk to you guys next week. If you have questions, please shoot me an email.